Hi everyone, my name is Karen Dees. I am the marketing manager for Patient Concierge Services, and we have a private Facebook group called STAR, Surgical Transformation and Aesthetic Rejuvenation. And what we want to do for you lovely stars, our viewers and members of the group, is provide you with as much information as possible about anything aesthetic and cosmetic, because I'm still learning all the time. And today we have a fantastic opportunity to talk to Dr. Angita, who is a qualified plastic surgeon at Bunda Hospital. She is qualified in all kinds of procedures, tummy tucks, mummy makeover, breast augmentation, facelifts. The list goes on, but today we want to understand more about bleph. Upper, lower, both. Why are some of them $900? Why are some of them $3,000? Which is more easy? Which is more complex? So before we dive into the bleph, Dr. Angita, would you like to introduce yourself and tell us a little bit more about what you do in the hospital?
Yeah, hi everyone. I'm Dr. Angita. I'm a plastic surgeon in Bunda Hospital, Denpasar.
Yes.
And I work as a plastic surgeon here. I do cosmetic or aesthetic surgery and also for reconstruction as well.
Reconstruction.
Yeah.
Is that for somebody who's had like maybe an accident or
something like accident with fracture, trauma, or even for burn cases or burn injury.
Yeah.
The other case I do cosmetic or aesthetic surgery. Such as for facial aesthetic surgery like facelift, blepharoplasty, rhinoplasty, and also for body aesthetic surgery like tummy tuck liposuction for abdomen or arm liposuction.
Oh my goodness.
And also for the breast, of course.
So you do a lot. Yeah. Do you have a favorite procedure?
Yeah. Of course. It's actually based on patient desire and patient needs.
And how long have you been practicing?
Right now it's my second year.
Your second year,
in Bunda Hospital.
Yeah. Okay, fantastic. So obviously you have a full repertoire of different types of surgeries that you could do, and we only have maybe a short amount of time this morning, so it'd be really great to understand more about bleph. How do you say it?
A blepharoplasty.
Blepharoplasty.
Yeah.
I don't know why I really struggled to say it. I'm just going to say bleph, upper, lower.
Upper, lower, blepharoplasty.
Yeah, okay, great. So I've prepared some questions. If it's okay, we'll have a little deep dive into some of them. So the first question is, what are the different types of bleph? How do they differ in terms of technique? You know, if we could break it down to upper, lower, what is double eyelid surgery, and maybe explain whether they're functional or cosmetic.
Oh, all right.
Sorry, that was a lot of questions in one sentence.
Okay, I
you
get
can
it.
say what you want.
Well, first of all, like blepharoplasty generally means a plastic surgery, a plastic procedure to improve the eyelid.
To improve the eyelid.
Yeah.
So mostly the eyelid.
Mostly the eyelid.
Okay.
And there are some types of blepharoplasty based on the aims or the goals.
On the goals.
Yeah.
Okay.
Like upper blepharoplasty, lower blepharoplasty, and also double eyelid surgery.
What is double eyelid surgery?
Well, upper and lower blepharoplasty.
Oh, it just means at the same time, like both of them?
No, for double eyelid surgery is like especially for upper eyelid.
Okay.
The aim is to create a crease.
A crease.
A fold.
A fold.
Yeah. Usually for Asian, we also know it as Asian blepharoplasty. Because most of the Asian has single eyelid, means like no crease. So we do like incision and like anchoring the skin to the underlying tissue to make a crease. The aim is to make our eye more defined and like a more open look eye. And mostly patients who do double eyelid surgery is in a young age.
Okay.
It's different with the upper and lower blepharoplasty. For upper and lower blepharoplasty, usually caused by the aging process.
I see.
Because while they're getting age, the skin getting more laxity.
Laxity?
Yeah.
So it's like more loose where you can
more
pinch
loose,
it?
right?
Yeah.
More loose, more laxity. The muscle of our eyelid getting weaker and also we get more fat deposition.
Okay.
That's why we can see a lot of cases of like hooding or drooping eyelid, and also eye bag, and also like bulging or puffiness.
Bulging or puffiness. Yes, I think I've seen
and
this.
In some cases, some patient also even like it can like disturb the vision field of the patient.
The division field, did you say?
Yeah, vision field. So
vision field. Okay,
yeah, vision
I see.
field.
Yeah,
so
yeah.
Because of
it can block the vision?
Yeah, it can block the vision.
Wow.
Because of the hooding eyelid.
Yeah.
That's why, that's the aim.
That is the aim.
Of doing upper and lower blepharoplasty to reduce the hooding or drooping eyelid, to reduce the eye bag, and to reduce the puffiness.
I see. So basically what you're saying is it depends on the goal. So somebody might not really care about the aging process, but they can't see very well.
Yeah.
And actually the goal is to just see better.
Yeah, as a functional.
Okay. So to improve the vision for something that's blocking, that would be functional.
Yes.
And then obviously cosmetic would be to improve
the appearance. For more like youthful appearance.
Yeah. I had upper bleft done maybe 8 years ago.
Oh.
Yeah, I actually got it done in Poland because I was living in England at the time.
Okay.
And I was awake when they did the procedure.
Oh, yeah, local anesthesia.
Yeah, but it was quite fast.
Yeah.
It was done in like maybe 25 minutes.
Oh, yeah.
But it wasn't nice being awake. I could feel the tugging, all of the... And then they had to burn it. What is it called? Cauterizing?
Yeah.
Oh, I can smell it.
Cauterization, right?
Cauterization.
Yeah.
What is that? Is that like the muscle or the fat?
Yeah, sometimes we do cauterization, like first for bleeding control.
Bleeding control. Oh, okay, so it stops the bleeding.
Yeah.
Okay.
And second, for the muscle and the fat to it's not bulging anymore.
It's not bulging anymore.
It's not bulging anymore, so that we do like cauterization.
That is so interesting, because when I look at photographs of before I had the bleph, I didn't necessarily look older, but I noticed that the skin was pushing on my eyelashes, and my eyelashes were kind of going forward. And then after the bleph, oh my God, I could do my makeup so good. I could get the makeup brush into the groove of my eyelid, and it was I just felt like it, it really improved the overall, like I would look more awake. I wake up in the morning and I'm like, damn, I actually look like I've slept well. Okay, that's fantastic. It'd be really good to understand a little bit more about the procedure, because even though I had upper bleph, I didn't have a clue, if I'm honest. I just said, make it look better. And the doctor never really explained to me whether it was just skin or whether it was muscle or whether it was fat. And I think a lot of our viewers inside Star don't really know either. Like there's doctors out there that might only charge 900. And from my understanding, that means that it's more of a minor procedure, like they're only taking skin. And then of course if it's maybe a little bit more complex, whether there's more fat or muscle repair, or I don't know, like I've heard that sometimes you can, is it a fat relocation or muscle relocation?
Okay.
Tell me what's happening there, like what is that, how do you know what to do?
All right. First, maybe I will talk about the upper blepharoplasty. Okay?
That would be good.
While doing upper blepharoplasty, firstly that we will make incision. Incision that we cut the skin.
Can I ask a question? How do you know where to do the incision? Would it be in the fold?
Yeah.
Like there, yeah?
Basically, the first incision placed on the natural crease.
On the natural crease.
Yes,
okay, so it's hidden. Yeah.
That is hidden.
Yeah.
So if there is a hooding eyelid that we have to like attract.
You then have to make the fold.
Yeah,
okay.
The fold. So the incision will be placed on the natural crease, and then we will remove the loose skin, like extra skin. But we have to make sure that the position of the eyelid is normal. So it's not like retracted by that
too high.
Because so we have to make sure that the amount of the skin that we will remove is enough. Enough, not too much. Also can remove the extra fat, the excess fat.
So is there like a fat cushion, would you call it, underneath?
Yeah. Like there is some like space that consists of fat that's like bulging. We only like remove the bulging fat, not all the fat.
No.
Not all the fat. That's.
Would you just like trim the top layer off?
Yeah, like a trimming.
Okay.
The fat in enough amount.
Okay.
So that there's no bulging anymore. It cannot be like too much, because if it's too much, it can even make like a hollowing. And it's not good.
Can I ask a question before I forget? Some of our patients have been told by other doctors that they want them to be awake so that they can have them open and close their eye.
Yes.
But of course, most people want to be asleep, because it's quite scary. What do you recommend?
Yeah, so it can be done either in local or general anesthesia, right? So first, based on the condition of the patient and also the patient desire, of course.
Okay, so if they're feeling pretty confident and they don't want general anesthetic,
so you do like local anesthesia.
Then you can have the local where you just numb the area and then they can open and close.
In local anesthesia, if the patient is like
nervous?
Like nervous. I think it's not fit with patient it's quite nervous, because when we get nervous, we got like higher blood pressure, and it can increase the risk of the bleeding.
I didn't know this.
Yeah.
This is really good information.
Yeah, but if the patient is like, okay, relax, and it's okay, it's better to do the local anesthesia. Why? Because during the surgery, that we can always make sure that your position of the eyelid, because you can like open and close your eyes.
Okay.
And you can like discuss it with the patient. I think it's enough. It's okay. It's all right. Okay, done.
Okay.
Because basically in cosmetic surgery is what the patient desire actually.
Okay, that's so interesting.
Different between local and general anesthesia.
So let's say somebody has bulging eyelid and they have bags underneath for whatever reason. I guess this can happen at any age, depending on how they've looked after their skin and things like this. And they want to have upper and lower done at the same time. Is there any risk with that? Like if you take, you know what I mean? Is it a really dramatic look, or can it be still quite natural?
Basically, any kind of surgery, of course, they will create like counter swelling, bruise. It's normal. And doing upper and lower blepharoplasty at the same time, it's common. It can be done at the same time. And there are some like your consideration whether you want to recover in the same time. I think it's better to do it at the same time. But if you feel like I cannot like bear the swelling, that's
I guess too much. The recovery is longer.
Actually, for the swelling and the bruise, basically will gradually decrease, and it will like disappears around 2 until 3 weeks.
Is it longer if you have upper and lower done at the same time?
For the process, it's like quite similar.
No, I mean the recovery.
For the recovery.
Would it be longer than 2 or 3 weeks? Because it's like 2 operations?
The healing process is still like
similar, the same.
But the difference is maybe because the swelling is on your upper and lower, it can like pickle on your side maybe, and you feel more uncomfortable because the swelling is on your upper and lower. But the time of the healing process, I think it's similar.
It's still the same. So if you can cope with
it's based on your comfort,
on how much you can tolerate.
How much you can tolerate and your comfort of.
Okay. So who would qualify for a lower bleph? Because I've been curious about me lately. So if you were to look at me, like when I'm still, I don't think it's too bad. But when I'm smiling and I'm laughing, I notice I have pockets. Do you think I qualify or not?
I think you qualified.
I could qualify for it? Yeah.
Because lower blepharoplasty, basically, yes, of course, for that sagging eye bags and also to smooth out the wrinkles. Because we remove the excess skin and also we do like tightening of the muscle and the skin. Okay. And also we can like doing a fat repositioning.
Okay.
The aim of a fat repositioning is to like giving a volume, because sometimes the problem of our eyelid is not only for the eye bag, but after we like remove the eye bag, it's like look like a hollowness.
I see.
You know, so like a sunken eyes.
Yeah, where that's a bit sunken there, you can relocate the fat so it goes more full and more youthful.
I think in hollowness, eyelid and also sunken eyes will look like it's not good.
Okay.
Yes. That's why we have to fill it with the fat in enough amount.
That's fascinating, because when I think of people who've had lower breath, I've never heard of them sharing the story of the fat being relocated, but it sounds like from what you're telling me, it goes really well to do it together.
Yeah.
So to remove the bags and to reposition the fat, so that it's a better overall look, and I guess it will look better for longer.
Yeah.
Like maybe like 10, 20 years.
Yeah. Because not only removing the fat, but we also relocate the fat. It means that we will fill the fat on the perfect place. It's called like a fat filler, actually. Yeah. So make our look more youthful, actually.
Yeah, I tried putting derma fillers to increase my hollowness, and it looked terrible, and I had to get it removed. Because I like to go for short runs, and whenever I would go for a run, it would swell up, and I had to get it removed. It just didn't work. This was in England. It wasn't in Bali. Yeah. So it's really interesting to hear this. So yeah, fantastic. Thank you. Yeah. I've heard there's lots of different types of techniques. Could you explain a little bit more about anything that you've learned about that we can share with the audience?
Yeah, okay. So there are some techniques, the new technique, and maybe the aim is to make the procedure more simpler.
Simpler?
Yeah, simpler.
Okay.
Simpler procedure, and also for scarless result.
Scarless. I think everybody loves scarless procedures.
Yeah.
How do you do scarless? Yeah.
So for the scarless procedure, is based on the incision, how long the incision, and also the technique of the stitches.
The technique of the stitches. Okay.
By the new technique that we can make the scar, it's not really obvious. And even for some case, not all the case, that like we can do like lower blepharoplasty without skin incision.
Whoa, what? How do you do that?
Like there is no incision or on the skin. So we do incision like on the inner surface of the eyelid. You know, we call it transconjunctival lower blepharoplasty.
Could you say that slower for the camera? Because I'm not even going to try and repeat it.
Like lower. Transconjunctival.
Transconjunctional.
Transconjunctival.
Our film lady's going to write that down for everyone.
Transconjunctival lower blepharoplasty.
Okay, but it's where do you go in?
So we do incision like, you know,
on the line of the inside
the inner surface. Only to remove the fat and relocate the fat, not to remove the skin.
Okay, so it's only for fat relocation and not to remove the skin.
So the best candidate is for the patient with a lot of fat deposit, but still have like a very tight skin.
So how would that happen? Is this like someone's put on too much weight, or is it like an aging thing, or are they born with it?
Yeah, because there are a lot of factors actually.
Okay.
Yeah, because some people like tend to have an eye bag, like more fat.
It's just the genetics.
It's just a genetic
DNA, inherited from their parents or whatever. Okay.
So that's why maybe more fat deposition on the lower eyelid, still in a young age. So we can like just remove the fat and like relocate the fat, and then it's like will heal faster because there's no incision of the skin. But it's only for the good candidate.
Okay.
Sometimes because we like combine it for the skin with laser.
What kind of laser?
Yeah, for the skin tightening of our lower eyelid, we call it like RF laser.
Is that radio?
Yes.
Frequency? No?
Yeah, fractional.
Radio frequency. That's for music.
Yeah, like a fractional. Laser.
So what does that do? Does that stimulate the collagen, or?
It's like stimulate this collagen and make the skin more tight.
Permanent?
If the skin is still like not really severe, it's
not
on the
severe.
mild.
Okay.
You understand that, like
so
on the mild case.
Okay, so if somebody was like maybe over 60 and they had quite sun damaged skin, they probably would not be suitable for it.
Yeah, but the skin is still tight.
So it's more for tighter skin. I see.
Only laser and do like removing the fat only. Yeah, it's one of the a new, like not really new, but other option.
Yeah.
Other option. But mostly if the patient with a loose and sagging skin, we have to like remove it.
Oh, wow.
We cannot do like scarless with that kind of a person.
God, there's so many options, right? What about, is it something to do with a brow lift? What's that one?
Okay, for the upper blepharoplasty, we have like other option.
Did you say a Korean brow?
Yeah,
lift?
it's called a sub-brow lift.
Sub-brow lift.
Yeah, sub-brow lift. So it means that it means like below
the eye.
Yeah, just below the eyebrow.
Below the eyebrow. So what, here?
Yeah,
and that would affect the eyelid.
Yeah, that affects the eyelid. So it's only to remove the bulging or the excess skin just below the eyebrow. So if we get a candidate that the bulging is only just below the eyebrow, we can do the sub-brow lift. It's simpler and the recovery is faster.
So what's the difference between a sub-brow lift and an upper bleph?
Okay. The difference is the location.
The location and also the location is because the sub-brow lift is just below the eyebrow, so that we cannot cannot improve the overall of the eyelid, of the upper eyelid, but by doing upper blepharoplasty, that we can do like the overall side of the eyelid, and even we can make the crease. By sub-brow lift we cannot make a crease. Can you do an upper bleph and a lower brow lift at the same time? Is that ever recommended?
Doing both? Doing both, blepharoplasty and
sub-brow lift.
If
they have a lot,
Sometimes after we do upper blepharoplasty, that we think that there's still a bulging just below the eyebrow. We have to remove it
because it would look strange, wouldn't it? Otherwise, Gosh, there's so many choices.
It depends on the condition of the patient, the desire of the patient after. So that's why we have to give some option. Can you tell us about a situation where you've had a patient and it was quite complex? It wasn't just a simple upper or lower bleph. Have you had any of this? I think a difficulty, in my opinion, if I get a patient with asymmetry.
Asymmetry.
Does that mean it means that the right and left side is different.
Okay, that's more hard
for me. Because we have to adjust the symmetry of the eyes, because normally our eyes is not that really symmetric. Everybody. Okay. Any kind of our side, like hands, our breast. It's like not 100% symmetric actually, but sometimes, in some cases, there are some patients that really obvious. It's more obvious,
like left or down or up. Okay. And you, if the patient wants to try and correct it so that it's more symmetry, is that quite complex to do? I bet they would look quite different afterwards.
And maybe for the more complex case, when we find the patient with a lot of like wrinkles, aging signs, that after maybe we have like a combination with the facelift as well.
Okay. Yes, we've had quite a few patients that have had facelifts
not enough,
and bleph at the same time, because otherwise they have this beautiful fresh face, but then their eyelids are still quite heavy. So it's quite common, I've noticed, with some ladies, especially maybe over 50. If they've lived in Australia and, you know, the sun damage.
We usually recommend to do it with the facelift.
Yeah. Amazing. Thank you. For patients that are visiting Bali from Australia, they normally need to understand what the recovery time is like. You know, do they need to book into a hotel? Do they need to stay overnight in hospital? I guess each patient is different. Sometimes they can come in and leave the same day. Could you tell us a little bit more about the recovery process?
Okay, for blepharoplasty or any kind of surgery, of course, we need, before the surgery, we need a consultation first.
Of course.
To make sure that patient is fit enough.
Fit enough. Okay.
So there is no serious medical condition. There is no eyelid disorder or infection, so there is no like trauma.
Yeah, like underlying illness. So would you check their blood and maybe some other health checks?
Yeah.
What health checks do you do?
So basically, for the blood check, we have to make sure that you have like normal like hemoglobin.
Oh, I see. So for the recovery process, is it white blood?
For the healing process.
The healing process. Yeah.
And then there's no other serious medical condition like hypertension.
Okay.
Hypertension is okay. We can still
manage it.
Yeah. We can manage it with medication if it's already controlled and it's okay. The blood pressure is normal after the medication. It's okay.
Okay. Yeah.
And it is prior the surgery, right? And during the surgery, like I said before, it can be done in local anesthesia or general anesthesia.
Okay. Yes.
If it is done in local anesthesia, basically we can do like one-day care surgery.
One-day care. So that means they're in and out on the same day?
Yeah.
Okay.
We can, maybe we just like do recovery after the surgery about maybe only a few hours, and after that, if there is no any other complaint,
they can just go back to their accommodation, relax. Okay.
One-day surgery. But in general anesthesia, it's based on the condition of the patient. Yeah, because after we got general anesthesia, of course, we got like a defect of the anesthesia.
The effects of the anesthesia,
If the patient feel like, hey, I still like a little bit dizzy and I have to like stay in one night, it's okay.
Yeah, I think it's like you say, it's the condition of the patient. Safety is the priority,
Yeah, of course.
So if they stay overnight, is the facilities at Bunder Hospital to stay overnight?
Course.
There is?
Of course.
Yeah.
That's why we have to make sure that you do the surgery in the trusted facility.
Yes. Okay.
Yeah, that's why. And also after doing the surgery, for the healing time, for the recovery, of course, on the first time, you will get a bruise, swelling.
Bruising, swelling,
Bruising, swelling, it's normal.
Yes.
And it will like gradually decrease.
Would you say the first 24 hours are the most critical?
Yeah. Actually, for the first 48 hours.
48.
I usually suggest for the patient put the ice pack regularly. It really helps to reduce the swelling, to reduce the breathing. So we always suggest to put like the ice packing.
Okay. So would the ice pack go over the eyes or just on the face?
Like on the side of the swelling.
Okay.
Yeah.
Because you have to be careful not to pull on the stitches, I guess.
As long as the stitch is secure.
Yeah, you mentioned earlier about the type of stitching techniques. Do you want to tell us a bit more about that?
Okay, for the stitch, actually based on the type of the tract.
Type of the tract? What does that mean?
The suture,
the type
material.
Oh, the material.
Yeah.
Okay, does that mean like dissolvable or removable?
And also based on the technique.
On the technique.
For the technique of the stitches, it can be like stitch just on the skin, right on the skin, or just like below the skin.
Okay.
It will give like different type of scars because when we do like more dots.
More dot marks. It's more trauma to the skin, I guess. Yeah.
So, but if you do like just underneath the skin.
So if you did underneath the skin, does that mean it'd have to be dissolvable?
Yeah, it can be dissolvable or not.
Okay.
If it's not dissolvable, we can like remove it. But we can still do it just underneath the skin.
Just underneath the skin.
Underneath the skin to reduce that dots.
Okay. Okay.
But actually for the scarring, it's also based on the type of the skin. You know, for Asian, it tends to be more scarring.
Oh, really?
Yeah.
Okay.
The type of the skin.
Yeah.
Than the
Caucasian.
Caucasian.
Yeah.
Right.
Oh, I didn't know this.
Yes. We have to take a look at what kind of the skin of the patient.
Yeah. Crunch time. How much are we talking? Is it thousands and thousands of dollars? And from what I understand, it's different patient per patient. But is there any way you could give us a baseline price? And then what would be the maximum that would pay for bleph surgery?
Okay, so for the price, of course, it's based on the type of the surgery.
And the
how
condition
complex,
and the outcome,
Yeah, how complex, and type of anesthesia, of course, and whether you want to stay
overnight
or go home. And maybe you can say that it starts in
15 million, was it?
Yeah, if it's simple.
Yes.
One side, like it means like only upper or lower. Only with local anesthesia, with simple case, one day care.
One day care, yeah. So 15 million is around 1,500 Australian dollars, I think. It obviously changes on the base rate. But that would mean local anesthetic where there would be no overnight stay. So if somebody wanted, do you do twilight surgery? The twilight anesthetic? So it's not full general, but I believe it's a bit less?
Yeah.
You do this?
Yeah. It's based on the time of the surgery. If it's not more than 2 hours, I think it can be done.
Okay. So and usually it's less than 2 hours, I think, if it's simple.
Yeah, if it's simple, it can do it in less than 2 hours.
And then what would be, so if somebody wanted a more complex case and they wanted twilight or general anesthetic and they wanted to stay overnight, what kind of price range would that be looking like?
It's based on the type of the room, actually.
Okay.
Maybe about 20 million or something.
Up to 20 million, 20, 25
yeah, based
million.
Because we have a kind of rooms.
Okay.
At least you will stay in a deluxe room here.
Yeah, you have a deluxe room, you have access to nurses. Thank you so much for that amazing interview. I feel very educated now on blepharoplasty, upper, lower, fat relocation, fat removal, muscle changing. I'm probably using the wrong words, but yeah, thank you so much for your time. That was fantastic.
You're welcome. Thank you so much for having me.
Yeah.
So I hope that we can talk for another time, another topic.
Yes. Anybody watching, what else would you like Dr. Angita to talk about? Comment below.